My name is Elena Arbelo. I am a cardiologist at Clínic Barcelona, and I work in the arrhythmia unit coordinating the sudden cardiac death and familial cardiomyopathies unit. Familial cardiomyopathies are diseases of the heart that have a genetic condition. It's an inherited situation where families have either a problem with the functioning of the muscle of the heart, those are familial cardiomyopathies, or the electrical activity of the heart, in this case, causing arrhythmias that lead to death. The way to detect this type of arrhythmias is by a multi-parametric evaluation. So what we normally do is talking to the patient, get a 3-generation or more family history, and then look at the electrocardiogram, at the structure and function of the heart with an echo plus other imaging techniques, and then we look from an electrical perspective that usually we do with either a stress test, so we evaluate the electrical function with exercise and during recovery, or we do it with a 24-hour or more registration of the heart rhythm. If we detect a familial cardiomyopathy, we would do a genetic test, and it is going to help us detect other family members at risk. Depending on the type of cardiomyopathy, we will adjust treatment with medication, and in any familial cardiomyopathy, those that are at high risk of sudden cardiac death may eventually need an implantable cardiac defibrillator. The difference between sudden cardiac death and a heart infarction or a heart attack is basically that heart attacks are caused by an obstruction of the coronary arteries. This may not necessarily cause death. Sudden cardiac death is an abrupt death in somebody that we didn't expect. The ultimate cause of a sudden cardiac death is the occurrence of a malignant ventricular arrhythmia. The cause for these malignant ventricular arrhythmias can be some electrical disease of the heart. Another reason are cardiomyopathies, somewhere where the muscle of the heart is either thick or dilated or has scars and produces these types of arrhythmias. A final subgroup could be either inflammation of the heart or myocarditis. Sports represent a situation where the heart needs to contract more in terms of strength and velocity. It beats faster, so we have more adrenaline in the body, and this may lead to a higher risk of malignant arrhythmias, and that's why in sports there may be a higher risk of sudden cardiac death. To prevent this, the most important thing is look around your family. Anything that may suggest that there's an issue with the heart in your family. With that, I would recommend to just have a regular cardiological checkup. Ventricular tachycardias are rhythms that happen in the lower chambers of the heart, which are the heart pumps, when they start contracting, beating in a chaotic way. By definition, all ventricular arrhythmias are risky. Ventricular arrhythmias usually lead to sudden dizziness and loss of consciousness. That is the most typical presentation. If that arrhythmia persists, that loss of consciousness then leads to death. If the arrhythmia self-limits or stops, then what usually happens, that person that lost the consciousness just stands up, or wow, I don't know what happened. The least frequent thing that you may have in ventricular tachycardia is palpitations. If you feel palpitations, that the heart is beating very fast, especially if you feel dizzy, you should also consult. When we're talking about dilated cardiomyopathy, it means that the heart has become larger than usual. Main manifestations of people have when they have dilated cardiomyopathy is shortness of breath, exercise intolerance, and then they may also have malignant ventricular arrhythmias that lead to death. Finally, patients may have a higher risk of stroke. Most patients with dilated cardiomyopathy get treated with drugs, and these drugs have the ability of preventing dilatation and even reversing this dilatation of the heart. In those patients where we have a very high risk of sudden cardiac death, we would implant a cardiac defibrillator under the skin. Marfan's disease is a disease of the connective tissue of the body in general. The critical aspect of this is the diameter of the aorta. This aorta, beyond being dilated, because you have a connective tissue problem, it's very friable, so it's weak and it may rupture. So the important thing is that whenever there's a family where you detect a MARFAN, you need to evaluate the family, and what you establish is regular checkups so that you monitor the size of the aorta. So if it starts enlarging to a critical point, you may consider an intervention. I chose to start working with BARNACLÍNIC because it opened up the possibility of providing expert multidisciplinary care and reach more people. We are a national and international reference center. We can offer the possibility of multi-parametric, highly specialized diagnosis so that if any patient wants to, let's say, go to the best, they have the possibility of doing so.